Alright, for our drugs that attack flatworms, pretty much all of them are going to be there to paralyze the worm, and so it can detach and then come out of your body. Depending on the worm, treatment may vary from take it once, take it again after a couple weeks, or stay on it for 3 months until you're completely clear. Lots of different ways to go about it. It just depends on the worm. For your roundworms, pretty much any of these work. So mebendazole, Priantel palmate, albendazole works really well. For your pinworms, your mebendazole and your Priantel palmate work for those. For hookworms, only mebendazole is indicated for it. The other two don't really work on it that well. For your tapeworms, praziquantel is used. For your piperazine, is really good at causing flaccid paralysis, so it blocks acetylcholine's response. And then for Priantel, for your palmate, it inhibits cholinesterases, which causes a spastic response. Piperazine works really well against your pinworms and your roundworms. Side effects of these: nausea, fever, headache, cramps, diarrhea. Occasionally you can get tinnitus, the ringing in your ears, hypotension, and paresthesia. Okay, moving over to antiseptics and disinfectants. Both of these are used to just stop infections, right? It's to clean areas or the skin. Typically, if it's an antiseptic, it's going to be used to clean the body, right? So, things that are going to be applied to the skin, to the mucous membranes, to cuts, to wounds, that kind of stuff. Those are always going to be your antiseptics, while disinfectants are typically used to clean stuff like floors or surgical utensils, that kind of stuff. Both of them, though, are there to destroy microorganisms on contact, not to be taken internally, right? Alright, so sources of infection. Microorganisms, they're everywhere. You find them all over the place, all over your skin, all over your desk, wherever you go, there are microorganisms. Anytime you get a simple wound, like you can just scrape your knee, and you're providing access for pathogens to get into your body, right? You can get little cuts that then get infected or go through inflammation. Places like hospitals, nursing homes, and other like health institutions have increased risk for starting infections. Stuff like bed sores, right? People who go to the hospital have trauma, surgery. These are all creating opportunities for pathogens to enter your body. And they also increase these nosocomial infections. These are just infections that happen at hospitals. Typically, the bugs that can survive in hospitals are really stout. And so a lot of your superbugs come from these nosocomial infections. So we can break our antiseptics and disinfectants into like two major groups: microbicidal or microbiostatic. These are going to kill them. This is just going to stop the growth, so it's going to inhibit growth or spread on an area. And then you can get more specific by being like, this is a bactericide, this is a fungicide, like this kills specifically bacteria or funguses. The first group will be your formaldehydes, glutaldehydes, or your iodine solutions. These are really broad spectrum disinfectants, work really good on a lot of different stuff for bacteria, funguses, and viruses. Then you have your hexachlorophene, your benzoalkonium chlorides, These are very specific for gram-positive bacteria, which is okay because a lot of the organisms that you get on your skin will be gram-positive bacteria. And so these are really good for cleaning skin. Alcohol is a really good microbial side, especially for vegetative bacteria, things that are growing on your skin. It's also used as an active vehicle. So for a lot of this other stuff, they need to be dissolved into a liquid. And if you dissolve them into alcohol, you kind of get this synergistic effect of the alcohol and the other disinfectant working together to kill the microbes. And that's what makes it an active vehicle, is that it is actually participating in the process, where water would just be a vehicle, a not active vehicle, right? It's not going to help kill it. So here is a table with a bunch of different disinfectants, antiseptics, and if you can use them as antiseptics, like formaldehyde, don't ever use any of the aldehydes as antiseptics, right? But you can use them for cold sterilization of equipment. Cold sterilization is when you want to sterilize something, but it could be a heat-resistant organism, so you can't put it like in the autoclave because it's not going to respond to the heat. The heat's not going to kill whatever that is, and so you can use cold sterilization instead. So, talking about autoclaves and sterilization, the difference between like just disinfecting and sterilizing is if you're going to sterilize it, it's going to be the complete elimination of all those microorganisms and their spores. So a lot of bacteria can form spores, fungi can form spores that then can go on to cause infections. Your autoclaves, these are really high pressured systems that use steam and heat to disinfect or to sterilize. It's kind of like an Instapot, except for like surgical equipment or equipment that you need sterilized. We don't have rooms big enough or autoclaves big enough to fit a room in them, right? This is just for like individual equipment. So if you have to sterilize a room, you're going to have to use a sequence of disinfectants, because only certain disinfectants, like we saw earlier, right? Only some of these are effective against bacteria. Some of these are only effective against like gram-positive bacteria. And so your company or who you work for, there's going to be a sequence of disinfectants that you use to sterilize a room. Surfaces, like your fingernails, walls, open wounds, they all need to be cleaned before you disinfect or before you use your antiseptics, because any organic matter can bind to the cleaning product to stop it from working on the bacteria. Or the organic matter just stops it from getting deep enough, like it won't have enough penetration to get below whatever that organic matter is, so you really need to clean it before you disinfect it, right? Or before you use your antiseptic. And depending on what you're doing, like, you might need more cleaning or less cleaning. So if you think about, like, getting a flu shot, right? The nurse, whoever, will come over, couple swabs with an alcohol pad, and then give you your jab and go on. Or just like a blood draw, right? A couple swabs with the alcohol pad and then pull the blood. But if you're gonna like donate blood, you're probably gonna have an iodophor solution, so kind of that brown stuff, and they're gonna go over it like multiple times. Because how long is a typical blood draw? Maybe a minute, like max. Versus when you're donating blood, it could be like 45 minutes, maybe even more. And so since you're going to have that wound with that tube in there open longer, they really want to make sure you don't get an infection from that. And so they're going to clean that area really well. The longer the hole's there, the more risk you're going to have of getting infection. With your blood draws, they're really quick, so you don't have to do a lot of cleaning before that. So the common chemicals that we use to disinfect or as antiseptics are going to be your iodophores and chlorine bleach is one group. Your iodophores are going to be stuff kind of like betadine or DuraPrep, typically used for de-germing your skin. So for a lot of surgical prep, you're going to have these iodophores. If you're allergic to iodine or betadine, then they'll either put you on like an antihistamine and then do it, or use something else. But it's really rapid acting, and it works on a broad spectrum of microbials. Chlorine bleach, man, stuff's fantastic, right? It kills like everything, even stuff that's really hard to kill. So like MRSA knocks it out. Tuberculosis knocks it out. Like, it kills a lot of different bugs. Typically used in a 5 to 10% solution. Make sure to use caution when you're cleaning with bleach, because it is caustic to your skin. It'll cause, like, if you just get it on your skin, it'll cause your skin to really dry out. It's mildly carcinogenic, which means it can cause cancer. Especially if you're using high concentrations, make sure the room's well ventilated, because it can burn your lungs, also your eyes. So wear goggles if you're going to be using chlorine bleach so you don't get any in your eyeballs. Also, don't expose it to ammonium or vinegar, because it can release chlorine gas, which is deadly. Don't want to die because you're cleaning, right? And then our alcohols. With a lot of the alcohols, there's not going to be any persistent antimicrobial activity. It's pretty direct. Like, it happens, and then it evaporates off. And so it doesn't have any lingering effects. Your iodophores have really good lingering effects. Alcohols can lead to skin irritation because it is pulling the water out of your skin and also cooling. And it's flammable, so make sure not to, if you're cleaning somebody with alcohol, don't have them near an open flame. And then our last groups are hexachlorophene and triclosans, really good at stopping bacteria growth, specifically gram-positives. Again, this makes it really good for skin prep because a lot of the bacteria are gram-positives. Your peroxides, oxidizing agents for cleaning wounds, hydrogen peroxide. You've probably used hydrogen peroxide before on a wound, especially superficial wounds, ones that just kind of have a little bit of oozing blood. You pour the hydrogen peroxide on there. It starts to oxidize and forms the bubbles as the oxygen comes out, which could be really good because the oxygen can also free any lodged pathogens and help kill them and get rid of them. Your body uses hydrogen peroxide to kill bacteria with your neutrophils. They'll release hydrogen peroxide. It's also can be really good as an oral rinse to kill any bacteria in your mouth, but with continued use you can get hairy tongue, where the papilla on the tongue, the bumps on your tongue, get really large and look kind of hairy, but it's not actual hair. And then benzoyl peroxide, if you've ever used any acne products, you might have benzoyl peroxide, probably with like retinoic acid. Again, it releases the oxygen, which is really good at killing anaerobic bacteria, like the bacteria that can cause cystic acne. Your chlorohexidine, broad spectrum, including HIV, but it won't get rid of any bacterial spores. So just note on that. How it works is it gets incorporated into the cell wall and goes into the cell and can alter the DNA. Used in a lot of mouth rinses, also hand disinfectants. And then lastly, heavy metals. There are a bunch of different metals out there. Silver nitrate is a pretty common one for ophthalmic antiseptics for newborns. So when the baby comes out of the vagina, if the parent had chlamydia or gonorrhea, then that child could get infected with it in their eyes. And so in some states, it is a law that you have to use silver nitrate as an ophthalmic to just clear out the eyes so that newborn doesn't get ocular gonorrhea or chlamydia, which can cause vision problems later on. It can also be good for burns, but it can cause permanent skin stain. And that is it.